How could one organization catalyze transformational change in the health system across our entire country or the entire world? I published an op-ed in a local newspaper today making the case for that a new medical school could contribute in a substantial way to transformational change in our country's health system using Johns Hopkins as a model. I'm Dr. Chad Swanson. I'm an emergency physician and I'm passionate about transformational change. I see the need for transformational change every day with my patients, but also my friends, family, neighbors. We can do much better as a country. So there was a question that one of the online commenters made about how this could actually happen. And this commenter shared a number of very true facts about our health system and doctors and how it would be difficult to include transformational ideas into a medical school curriculum, and how when physicians go out into practice like myself, we become invested in the system, and there's so much momentum around fee-for-service and episodes of treatment. So let me just share my 5 recommendations, and I'll comment on those, and I'd love your feedback and criticism. So number 1 is really the most important, and I can't emphasize this enough. This is more important than the specifics of a curriculum, or more important of the specifics of which organization or which combination of organizations or which network of organizations. And that's just a relentless, widely disseminated, bold vision. For the vision that I came up with was we aim to catalyze a new paradigm for our health system, grounded in health and well-being for all at the lowest cost for the system. Now that might seem obvious, and yet our system is not grounded in health and well-being. Our system is grounded in episodic treatments, rescue treatments. I see that in the ER, that are fragmented, that are disconnected, that aren't related to a journey in health. And our system is also grounded in profits, and our system is also grounded in elitism. And so we need, more than anything else, we need a critical mass of people to create and disseminate a bold vision. And that's through stories and relationships, narratives. So in the late 1800s, the narrative was that medicine connected to science, germ theory, can really improve the health and well-being of people, and that can be done through treatments. And so that was the vision, and it gained traction, and it transformed through Johns Hopkins and the Mayo Clinic and a variety of other places and donors, that ended up transforming our health system. So number 2, create an institute at this university. So this is BYU, but it could be any university, any new medical school, for health systems transformation. So right now, as I see it, whether you work in a hospital like I do, or a university in the Department of Health, or in a public health organization, we're all working on specific. Like I'm focused on an individual patient at a given point in time. Of course I am. If somebody comes in with a hip dislocation or a pneumothorax or a bleeding gums or whatever the emergency, I'm focused on that patient. I should be. And university professors are focused on their specific class and getting grants and publishing papers, and public health professionals are focused on specific projects. And yet there isn't a unifying vision that brings us together and considers, okay, how is what I'm doing related to what they're doing? And are we moving forward with this vision? And so an institute could provide the seeding and a place where ideas and the urgency of health systems transformation could really be grounded. Now, there are organizations that I'm aware of, maybe the Robert Wood Johnson Foundation, maybe the Ripple Foundation. There are others, and there's lots of individuals that are committed to this, but there hasn't reached that critical mass of people. Just like in the 1880s and 1890s, there were individuals that were interested in germ theory, interested in hospitals, interested in research institutions, and yet there hadn't reached a tipping point that could lead to transformational change. So my second recommendation was to create an institute that's absolutely committed to health systems transformation. So that's kind of independent of the medical school. This would be in the university of itself, but it'd be very deeply connected to the medical school. Number 3 is ground the institute in complex, adaptive, social systems theory and methods. Our health system, I write, is, after all, is more like an ecosystem than a machine. Now, this is going to require some explanation that's beyond the scope of this video. But if you're interested in this, you can Google complex adaptive systems. You can watch some of my other videos. I've published on this, and lots of other people have as well. There's the Santa Fe Institute and many other places that focus on this idea of complex adaptive systems. But from my perspective, there needs to be a paradigm shift, a change in the way that we view the world, a change in the way that we view health. And so right now, I would argue that the dominant paradigm at leading institutions, whether it be Harvard or Stanford or any other kind of legacy institutions, well respected and elite, the foundational paradigm is biomedical reductionism. That is, we are dividing the parts of the body into different systems, and we have specialists that focus on the brain, and we have specialists that focus on the feet, and but also we divide the system up into parts. We have hospitals, and we have respiratory therapists, and we have public health agencies. So complex adaptive systems theory and methods allows us to consider the interaction between these body systems or between the entities within our health system, consider the interactions over time and how those interactions impact health and well-being for all at the lowest cost to the system in our society. And that's really what we want, right? It's not that we want episodes of care only. It's not that we want research projects only. It's not that we want a public health project only. We want all of those activities and developments to contribute to health and well-being over time, and we can do much better. So that's number 3, is a new paradigm. Number 4, require that all matriculants to the BYU Medical School major as pre-medical students in health systems transformation. I don't know that anybody else has proposed this. I don't know how serious I am about it. But the bottom line is drastic times require drastic measures. And currently, for reasons that we inherited, pre-medical students can major in whatever they want. I majored in philosophy. I have friends that majored in music and architecture and biomedical engineering. And you can major in whatever you want as long as you take basic science classes and do well in those. I think that the need is great enough to understand the drivers of health and the history of our health system and the economics and social change. There's so many factors that go into our health system. And so if pre-medical students majored in health systems transformation, there's at least a good chance that they would enter medical school with that mindset. And then they go out into practice with that. Whereas what I see now is professionals like myself are overwhelmed with medical school, overwhelmed with residency, jump into their private practice and overwhelmed with the challenges of being a doctor and being in debt, that we just don't have the time or mental energy to focus on social change and economics and health policy and health finance and organizational change. And so, I'm now 50, I'll be 52 soon. I'm seeing a number of health professionals who reach their midlife and kind of say, well, this all kind of didn't make sense and we could have done much better. Now, not only would there be a cadre of students every year learning about these major drivers of health and feeling the urgency of transformation of health systems and the role that they would play in the flawed system, but you'd also have economics professors and statistics professors and others, and even hopefully connected to the community within the university that would be championing these ideas. And then what happened at Johns Hopkins is they came up with an innovative model, and then that spread throughout the country over time because the rationale for it was compelling. Number 5 is lead the world in competency-based health professional licensing and certification. So the argument in my mind is pretty simple. If you have a nurse practitioner who has been excelling in an oncology clinic for 20 years, it makes absolutely no sense from a systems perspective for that nurse practitioner, if she wants to be an oncologist, to go back to pre-medical school and then medical school and then residency, so it would be 11, 12, 13 years, to become an oncologist when she has been excelling as a practitioner for 20 years. She might need a year of pathophysiology and pharmacology and ICU care. She might need 2 years or 3 years, but no way that she would need 11 or 12 years. So that's just one example that I see that could be revolutionary, that could change the institutions that we have. So you might point to existing institutions. You might say, well, maybe Harvard should do this, or maybe Johns Hopkins should do this. And maybe, but what I see as I look at history, and this was certainly the case with Johns Hopkins, is the founders of Johns Hopkins did not look to Harvard. They didn't look to the University of Pennsylvania for the most part. They went to Europe and they brought young, dynamic, even eccentric, in some ways kind of troublemakers. William Welch and William Osler and William Halstead and Howard Kelly were young, brilliant, dynamic, also kind of troubled. They were human beings that had a vision for something better and something different. Whereas those of us that are getting older in the current status quo, either we don't have the energy or we don't have the mindset or something to make these transformational changes. So I personally wouldn't look. I wouldn't look to the current institutions. We really have to use our imagination. And you can look at, I've given the example of the onset or the coming of cars. So if you can imagine living in the 1890s and you are a horse trainer and a horse breeder and you're invested in horses, and along comes this idea of cars, and you don't see any future in that because the roads aren't good enough, and it's unclear if they're going to be steam-driven cars or electricity-driven cars, and there's no gas stations, and it doesn't seem possible. And yet somebody with a vision of what could be possible in the future can push that vision along. And that's what we need. And that's what happened, I think, in the tech sector as well. So we look at the major companies in tech, whether it be Panasonic when I was growing up or IBM. And really what we need, what happened was young, visionary, brilliant, and really relentless, hardworking entrepreneurs, such as Steve Jobs and Elon Musk. And again, I don't want to get political about this. I know that those people have significant flaws, but we can't deny that in any industry, I don't think we need innovative, even a little bit kind of troublemaker type people to come in and say, this needs to be disrupted, this needs to be changed. So I'll go back to the relentless vision. I hope that answers the questions that this commenter had. I'd love your comments, criticism. I'd love